If you drink honey every morning, take diabetes medication, or have been told that your kidney function has even slightly declined, then you are fortunate to be watching this video. Many people start their day with honey water or ginseng soaked in honey, believing it is beneficial for their health. If that sounds familiar, please stop and put that glass down now. What you believe to be a health supplement may actually be acting as a concentrated sugar that further damages already weakened kidneys. A widespread belief exists that refined sugar is harmful because it is artificial, while honey is safe because it is natural. However, for people over 60, especially those with diabetes or kidney disease, honey can be extremely dangerous. It thickens the blood, strains blood vessels, and accelerates kidney hardening. What once supported your health and youth may now push you closer to dialysis. In my clinical experience, nearly 9 out of 10 patients who believe honey was harmless continue consuming it daily, only to arrive at the emergency room with severely worsened kidney markers. Why do hospitals and broadcasters rarely warn us about this? The uncomfortable truth is that selling health products often takes priority over protecting public health. I am speaking today because I genuinely do not want you spending the rest of your life attached to a dialysis machine. If you watch this video until the end, I will explain exactly why honey damages the kidneys and clearly tell you what you should eat instead to protect them. Please continue watching, not just for yourself, but for your family as well. You may wonder why university hospital doctors do not strongly warn against honey. Is it because they are unaware? No. Doctors understand the risks well. However, they are often given only a few minutes per patient. In that limited time, they focus on test results and medications, not detailed dietary guidance. This reflects the reality of the healthcare system. When blood sugar rises, medication doses are increased. When kidney function declines, patients are told to prepare for dialysis. Meanwhile, television promotes honey, propolis, and natural immunity boosters. The dangers of excessive sweetness in old age are quietly ignored, while advertisements praise these products as ideal health foods. Food companies profit from selling honey, and broadcasters depend on advertising revenue. Any warning that honey can seriously harm diabetics is either minimized or hidden in fine print. That is why I am here. Even if this message is unpopular or criticized, I will continue sharing the truth to protect people living with diabetes and kidney disease. The most common trap seniors fall into is the belief that natural automatically means safe. Nearly every household has a jar of honey. When feeling cold, people drink warm honey water. When tired, they eat garlic or ginseng preserved in honey. Even diabetics, who avoid sugar and sweet coffee, often use honey generously in cooking. Many believe that because honey comes from bees, it will not raise blood sugar or harm the kidneys. This assumption is completely wrong. For young, healthy adults, honey can help relieve fatigue. But once diabetes or kidney impairment is present, honey becomes a rapidly absorbed sugar that overwhelms the body. Garlic and ginseng themselves are not the problem. They are beneficial foods. The real issue is the honey coating them. That single spoonful consumed each morning forces intestines to work aggressively and strains the kidney filters as they attempt to process thickened blood. Small daily amounts accumulate silently, and over years, they can cause irreversible kidney failure. Kidney damage progresses quietly. By the time symptoms appear, recovery is no longer possible. What I am about to explain is usually discussed only in medical textbooks, but because it directly affects your life, I will explain it simply. Please focus carefully. There are 3 scientific reasons why honey damages the kidneys in people with diabetes. The first is its extremely rapid absorption. Foods like rice or sweet potatoes raise blood sugar gradually during digestion. Honey, however, is already broken down into simple sugars. It enters the bloodstream almost immediately. In older adults with reduced insulin production, this causes a sudden spike in blood sugar, making the blood thick and sticky. The kidneys contain millions of microscopic filters called glomeruli. Thickened blood clogs these tiny filters, much like grease blocking a drain. Once blocked, these structures harden and cannot recover, leading to lasting kidney damage. The second reason is fructose. Although often considered a healthy sugar, fructose is more harmful than glucose for diabetics. Unlike glucose, fructose is processed only by the liver. When consumed on an empty stomach, it rapidly converts into uric acid, which circulates through blood and settles in the kidneys. These crystals cause inflammation and gradually destroy kidney tissue. The third reason involves advanced glycation end products or AGEs. When sugar binds to proteins in the bloodstream, it forms harmful compounds that stiffen blood vessels. This process is similar to how meat browns and becomes sticky when cooked with sugar. In the body, frequent high blood sugar causes proteins to harden and stick to vessel walls. The kidneys rely on healthy blood vessels to receive oxygen and nutrients. When these vessels stiffen and narrow, kidney cells slowly suffocate and die. This is one of the main pathways leading diabetics to dialysis. Honey may feel energizing, but this sensation is temporary. The kidneys do not send pain signals until most of their function is lost. What feels like vitality is often a brief illusion. Removing honey today is one of the most important steps you can take to protect your kidneys. My strong language comes from real experience. Let me share the story of Dr. Park, a 67-year-old patient. He had managed his diabetes perfectly for 10 years through diet and daily exercise. His blood sugar and kidney function were stable. Then, within 3 months, his kidney filtration rate dropped sharply. When I asked what had changed, Dr. Park explained he began eating garlic soaked in honey every morning after seeing health programs on television. He believed it would strengthen his immunity and protect his kidneys. Instead, it caused rapid deterioration. The daily honey water consumed on an empty stomach overloaded his intestines and kidneys. Early warning signs like weight gain and foamy urine were mistaken for detox symptoms. By the time he came to the clinic, his condition was critical. Fortunately, stopping honey and receiving treatment prevented dialysis, but his kidney function never fully returned. This is not an isolated case. Behind the appealing image of natural food, serious risks are often hidden. So what should replace honey? Giving up sweetness entirely is unrealistic. Instead, there are safer alternatives. The first is stevia, a natural sweetener extracted from plants. It is hundreds of times sweeter than sugar, yet does not raise blood glucose, as it is excreted without being absorbed. The second alternative is monk fruit, known for its deep sweetness and zero-calorie impact. It is especially suitable for hot dishes and drinks. Both options satisfy taste without burdening the kidneys. To be cautious of homemade syrups like plum or omega extracts. These contain large amounts of sugar and are even more dangerous than honey. Fermentation does not remove sugar. For diabetics and kidney patients, these syrups should be discarded without hesitation. After removing sweeteners, focus on real kidney-supporting foods. 3 affordable foods can help restore kidney health. The first is cauliflower. Unlike many vegetables, it is low in potassium and safe for kidney patients. It also contains sulforaphane, which reduces inflammation and cleanses blood vessels. The second is egg whites. They provide high-quality protein without phosphorus, helping maintain muscle mass while protecting the kidneys. The third is garlic. When eaten raw or steamed without honey, it lowers blood pressure, improves circulation, and reduces kidney inflammation. Steaming garlic softens its sharpness and brings out natural sweetness. Adding it to rice is a simple habit that supports vascular health. To maximize results, follow a simple 3-day reset. Day 1 focuses on cleansing. Drink warm water upon waking and remove all honey and syrups from your kitchen. Day 2 emphasizes nourishment. Replace part of your rice with cauliflower and garlic and eat egg whites instead of heavy meats. Day 3 improves circulation. Finish dinner early. Avoid late-night eating, and gently massage the Yangchin point on the soles before bed. After 3 days, many people notice reduced swelling and clearer urine. These are signs your kidneys are responding. To conclude, this message is not about fear. It is about prevention. A single spoonful of honey, repeated daily, can silently damage your kidneys. Please share this information with loved ones so they do not learn the truth too late. Your kidneys depend on your daily choices. Starting today, choose wisely.